Welcome back. Today we're tackling a topic that doesn't get nearly enough attention, but could make all the difference for you or someone you love. We're diving into the 8 warning signs of pancreatic cancer, often called the silent killer, because it rarely shows symptoms until it's advanced. This makes it one of the most dangerous cancers out there, and why it's so important to be aware of the early clues your body might give you. Pancreatic cancer is notoriously difficult to detect in its early stages. The pancreas is hidden deep inside the abdomen, so tumors can grow silently for months or even years. That's why survival rates are unfortunately low. Most people are diagnosed when the disease is already advanced. But here's the good news. By learning to recognize the subtle, sometimes confusing symptoms, you can help catch problems sooner. Early detection can make a huge difference in treatment options and outcomes. Remember, these signs don't always mean you have cancer. Many of them can be caused by other, less serious conditions, but if you notice a pattern, or if symptoms persist for more than a couple of weeks, it's time to pay attention. If you or someone you care about experiences any of these symptoms that just won't go away, don't hesitate. Make an appointment with your doctor. It's always better to be safe and get checked out early. Let's break down the warning signs you need to watch for. Being informed and proactive could truly save a life, maybe even your own. First up, let's talk about jaundice, a condition that causes a noticeable yellowing of the skin. This yellow tint often appears in the whites of the eyes as well, making it one of the most recognizable symptoms. Jaundice develops when a tumor, such as one in the pancreas, blocks the bile duct. This blockage prevents bile from draining properly, causing a substance called bilirubin to build up in your bloodstream. As bilirubin accumulates, you might notice your eyes turning yellow, which can be alarming when you look in the mirror or when someone else points it out. Other changes can include dark urine, which may look much darker than usual, and pale or clay-colored stools, which are lighter than normal and can be easy to overlook. Another symptom is intense, all-over itching. This happens because bile salts, which are normally removed from your body, start to accumulate in your skin, leading to persistent discomfort and the urge to scratch. These changes, yellow skin and eyes, dark urine, pale stools and itching, are often the very first visible signs that something serious, like pancreatic cancer, could be developing. If you notice this combination of symptoms, yellowing, dark urine, pale stools and itching, don't ignore them or wait for them to go away on their own. These are major red flags that your body is trying to alert you to a potentially serious problem. If you or someone you know experiences these symptoms, see a doctor right away. Early action can make a significant difference in diagnosis and treatment. Persistent pain in the upper abdomen can be easy to dismiss, especially if it comes and goes or seems mild at first. However, it's important to pay close attention to any discomfort that lingers or keeps returning, even if it doesn't seem severe. Sometimes, this pain can be subtle, starting as a vague ache or pressure that gradually becomes more noticeable over time. When this pain radiates to your back, it's a significant warning sign that shouldn't be ignored. The sensation may start in the front but then spread, making it feel like the discomfort is wrapping around your body or settling deep inside. This type of pain is usually described as a deep, dull ache rather than a sharp, stabbing cramp. It often gets worse after eating a meal, especially one that's high in fat, or when you lie down to rest. Some people notice the pain is persistent, lasting for days or even weeks, and it doesn't go away with simple changes in position. The pancreas is located deep within your abdomen, behind the stomach, and close to your spine. Because of its position, a tumor or inflammation in the pancreas can press on nearby nerves, causing pain that radiates from the front of your abdomen to your back. This is why the pain can feel so deep and hard to pinpoint. If you find yourself reaching for over-the-counter pain medications, but the discomfort keeps coming back or never fully goes away, it's time to take notice. Persistent pain that doesn't improve with usual remedies, like rest or antacids, could be a sign of something more serious. Don't just assume it's a pulled muscle, indigestion, or something you ate. While those are common causes, ongoing pain, especially when it radiates to your back, shouldn't be ignored or brushed aside. Persistent, radiating pain in your upper abdomen or back deserves a doctor's attention. Early evaluation can help identify the cause and ensure you get the right treatment, so don't hesitate to seek medical advice if you notice these symptoms. Losing weight without trying. That's a big warning sign. Pancreatic cancer can disrupt your body's ability to absorb nutrients, especially fats, leading to rapid weight loss and muscle wasting. Even if you're eating normally, your body may not be getting what it needs. If you lose more than 5% of your body weight in 6 months without explanation, get checked. Unintentional weight loss is never normal, don't ignore it. A sudden persistent loss of appetite or feeling full after just a few bites is another red flag. Tumors can press on your stomach, making you feel full quickly or uninterested in food. This can lead to further weight loss and malnutrition. If eating becomes a struggle and you're losing interest in meals, take it seriously. Talk to your doctor if this persists. Chronic nausea and vomiting, especially after eating, can signal a blockage caused by a tumor. If food can't move through your digestive system, it backs up, making you feel sick and sometimes causing vomiting. This isn't the occasional upset stomach, it's a recurring problem that doesn't go away. If you're experiencing ongoing nausea or vomiting, especially with other symptoms, don't brush it off. Patterns matter. See your healthcare provider. Watch for major persistent changes in your bowel habits. Steatorrhea, large, pale, greasy, foul-smelling stools that float, can mean your body isn't absorbing fat. Diarrhea or constipation can also occur. These changes happen because the pancreas isn't producing enough digestive enzymes. Any significant, ongoing change in your stool's appearance or frequency is worth investigating. Don't ignore what your gut is telling you. Sudden onset diabetes, or a rapid worsening of well-controlled diabetes, can be an early sign of pancreatic cancer. The pancreas produces insulin and a tumor can disrupt this process. If you're diagnosed with diabetes later in life, or your blood sugar suddenly becomes hard to control, it's worth a closer look. This can appear a year or two before other symptoms. Discuss any sudden changes with your doctor. Cancer-related fatigue is more than just being tired. It's a deep, unrelenting exhaustion that rest doesn't fix. Malnutrition, inflammation, and the body's fight against cancer all drain your energy. If you're experiencing new, severe fatigue that interferes with daily life, don't dismiss it, especially if it comes with other symptoms on this list. Persistent, unexplained fatigue is a sign something's wrong. Get it checked out. These 8 symptoms, jaundice, pain, weight loss, appetite loss, nausea, bowel changes, new diabetes and fatigue, are your body's warning signs. Having one doesn't mean you have cancer, but don't ignore persistent patterns. Early detection saves lives. Share this video to help raise awareness. Someone you know might need this information. If you found this helpful, like, subscribe, and turn on notifications for more health tips. Take your health seriously and listen to your body. Thanks for watching, stay safe, stay healthy, and see you next time.